Hello, I'm Stuart from Croyd Medical, and this is the Febromed Multitrac. So we're just going to give you a quick demonstration now on a couple of things that you might want to try with the Multitrac. So I'm just going to ask Luke to come into shot. So the first thing is it's obviously a seat with a padded backrest. So you can see there if Luke sits on it, you've got quite a nice upright position on the backrest that's nice and supported. You've also got a shaped seat area there, and you've got the foot mat that comes with it as well, which gives you the option of having a nice wide foot placement, which is also quite comfortable. So a couple of things that you might also want to try is to use some of the additional accessories that come with it. So if we just take away the mattress insert there, what we're going to do now is bring into play the Pelvi Ball. So this one is the blue Pelvi Ball, which is 55 centimetres in diameter, and you'll notice that that just slots into the base there, and it's also got a steel base as well, an aluminium base, so it can't roll away. So when you sat on it, it's not like a normal birthing ball where it can just sort of roll off and you lose your balance, etc. It does make things a lot more stable. You can also see there that Luke's brought into play the yellow ball. The yellow ball is the larger option, so most people tend to go with one and the other one, so that you have an option for shorter and taller women. This one's 55 centimetres, this one's 65 centimetres. You can use them standalone if you wish, but they are designed to plug into the Multitrac there as well. The other thing that you can get with the Pelvi Ball are these covers, which are washable as well, so they go around it and zip up. So it just means that it's perhaps not, you haven't got the rubber or the plastic of the ball going against the skin. This just makes it a little bit more comfortable, but of course you can try other options for that too. So the other option that you might want to try there in terms of positioning, you can see that Luke is trying a kneeling position now and using the ball to lean over the top of it, again nice and stable and secure because it's inserted into the Multitrac. And of course with the foot mat you have a nice wide planting of the knees and the feet as well. So of course, your other option there would be for Luke to sit on the Pelvi Ball, and you can see there it's going to compress nicely. Luke can then lean forward slightly and get the right position with these knees, and then try a sort of 360 hip movement, and also a lateral type movement as well, side to side. And then of course the other thing that you would then try, the rope sling, which comes with the Multitrac as standard. This stores up here out of the way when you're not using it. When you want to deploy it, you literally bring it into play like this, and if I hand that to Luke, he can then lean forward and pull down using the rope. It's got a 135 kilogram weight limit, which is quite substantial, and you'll notice there that you can use different hand holding positions, and the other thing as well that's quite nice is during labour, when you've got the contractions going on, you might actually just want to lift yourself up a little bit and elongate the back, just to take some of the pressure away and try various different pressure positions. So again, the rope sling is really nice for that. So the other thing you might want to try, of course, is to take the Pelvi Ball away and use the Dulstein delivery stool. So if we move that one out of the way and Luke just drops in the Dulstein. The Dulstein is the delivery stool that again can be used in a standalone configuration, but also fits perfectly with the Multitrac system, and of course you can try the same range of positions there. The one thing that I would also sort of refer to as well is that with the Pelvi Ball and the birth stool, the idea is that the birth partner or midwife could also be sat here behind, and of course then you can try sort of shoulder massage and lower back massage, and of course the woman can lean forward quite a lot, and of course then you've got access to the whole back area, rubbing on the back, etc. So it is designed to be an assistance for both the woman and the birthing partner as well. Okay, So once we've got it finished with in this position, then we might want to take the Dulstein away. I'm just going to pop the rope sling over the top here and store that nice and safely. What you get one of these rope slings as standard when you order a Multitrac. We always recommend that you order at least one more because you'll want to take it away for washing, etc. in between. You don't want to be without one, so we generally recommend that you have at least one more. And of course, you're just going to drop that insert back into play like that. When it comes to cleaning and transporting the Multitrac, the cleaning of it is pretty simple. You can use chlorine-based solutions and wipes. All of that is absolutely fine. It's naturally designed to be used in the hospital birth centre environment. And when you want to move it, all you do is move the foot mat out of the way like that. If I just hand that to Luke. You take that away, and then all you're going to do is hold on to the pin here and just pull this backwards until you get to the wheels, and then you'll be able to move it around in the room. What we do suggest, don't tip it back so it's just in this position, tip it back so it goes into like a 45-degree reclined position, and you'll find it much easier to move around the room when you have it in that position. So I think that's everything. But if you do have any more specific questions or you require further information, please feel free to drop us a line at the email address that you can see on screen now, or alternatively, give us a call on the number that you can also now see. Thanks.